Thank you, Sherry. Thanks for having me. So we're going to talk about some osteoarthritis pain management strategies. And I was happy to see some of those quotes from prior sessions because you're going to see some information that really brings those back into our pain management strategies. So our goals for this evening are first to understand maladaptive pain and its impact on quality of life. We're going to hopefully develop a feeling for the evidence surrounding the use of supplements and also some drug therapy. We're certainly going to talk about a number of drugs. We're going to talk about NSAIDs, probably in a manner that's a little different than what you've heard before. And we're going to talk about some advanced strategies also. And so hopefully you'll develop an understanding of the benefit of joint injections for advanced osteoarthritis management. And we're really fortunate to have a number of options, significantly more than we've had in the past. And we're going to talk about each of those at least briefly and what data we might have to go with them. So I like to start off by saying what really is the most common source of maladaptive pain? Probably pretty obvious since we're talking about osteoarthritis, but I want to talk about old data and some newer evolving data. So originally, and going back 10, 20 years, and still people talk about this, basically that approximately 20% of dogs and 20% of cats have osteoarthritis. That being said, we can usually imagine in our practice, the way we function today, that 20% of dogs would have that. It's a little harder to imagine that even 20% of cats have it. And part of that is because we may not be asking cat owners the right questions. And as a result, we don't get the right information. And so a lot of cat owners just think cats don't jump because they're old cats. But we know that cats develop arthritis kind of in a different time frame than dogs do, and we'll talk about that. So it's important for us to recognize, and this came up, I can't remember whose quote it was, that we're treating dogs 7 to 12 years after their actual onset of osteoarthritis. And so we have some emerging data that shows 40% of dogs between 8 months and 4 years of age actually have arthritis already. So one of the most important concepts to take home is that osteoarthritis is a young dog problem. And you're probably going to hear that over and over during this whole series of webinars. But this is emerging data looking at dogs in general practice, taking radiographs of them, evaluating them for pain, and actually talking to owners. And what it's coming down to is if we ask owners the right questions, they can tell us about those intermittent, short-lived episodes where their dogs have limped but have gotten better. And everybody thinks it's no big deal, but those are probably dogs at risk that we need to really be paying attention to. And the other part of that is that we used to just think about breeds at risk. But as it turns out, this 40% of dogs covers breeds at risk and breeds that we don't typically think of at risk. So osteoarthritis is much more prevalent than we've ever thought. And so it is true, we are typically not treating these dogs for years and years after the onset of their disease. So it's important that we really question owners, for primary care veterinarians, at every vaccination, have you noticed that your dog has limped and then got better? And that for maybe 40% of dogs, the answer will probably be less. And then it's time to say, we shouldn't ignore this. Like, we should start paying attention to this. There's some early interventions that we can start making. Now, when we talk about cats, we know that 90% of cats greater than 10 years of age actually have radiographic appearance of arthritis. But the progression in cats is different. Young cats typically do not have arthritis, and the incidence of arthritis actually progresses as cats age. In dogs, the signs and symptoms associated with arthritis progress, but most dogs are starting out really as young dogs with arthritis. And so the rhetorical question that I like to ask is, are you treating all these patients? Like, this is a huge number of patients that really need to be assessed, treated, reassessed, and to recognize that osteoarthritis is no different than any other disease in that we have to pay close attention. You can't just like throw an NSAID at them and say, see you in a year. Like if you had a patient with some cardiac disease or renal disease, like we would never do that. And so it is important that as osteoarthritis patients age and the disease progresses, disease management gets more and more complicated. And that's no different than any other disease. I really like to emphasize that. So coming back to the prior question, what's the most common cause of maladaptive pain? The most common cause is osteoarthritis, and that's because it is also the most common source of long-term or chronic pain in dogs and cats.